use of robots in museums, which now with the world of Zoom is possible for people who can't get into a museum or into a cultural center. And I understand you have wonderful cultural centers in your city that could be used with this technology. Let's move on, please.
Yes.
This is an example of the Louvre in Paris, and I put this in because many times older people are taken to the museum with a special training. They who have not spoken for quite a while get excited about what they're seeing and therefore begin to speak, and it sort of stimulates the brain and is a means of dealing with dementia as well as caring in a community. Let's move on, please.
Mm-hmm.
Sorry. And this is an example of people. We sometimes say they can't do anything, but we don't give them the recognition. And if they're in a social center and somebody reads their poem or shows their artwork, and then they're recognized and stand up, you see them all of a sudden being so proud by the fact that they're being recognized. And I think the recognition is their contribution that I wanted to use in this slide. Let's move on, please. This is a quote from Ambassador Alvarez, and I think it's important when we're looking at aging in a new age. We need a new awareness that ability, not chronology, is the measure for how much people can contribute to society. So now the next steps are up to all of us. Thank you so much, Dean Rose. If there are any questions, we can answer later. Thank you.
Excellent, excellent ideas. Thank you very much. And I must share with you that there are cultural centers over here in Pakistan. But this is another idea, and we can take it to the next level by incorporating all these elderly, incorporating elderly type of activities over there as well. Thank you very much for your contribution. So that brings us to the next speaker of today's session, the next panelist, who is Dr. Nadir Ali Sayed, who graduated with honors from the Khan University Hospital and proceeded to the US for clinical training and subspecialization in neurology at the University of Medicine and Dentistry, New Jersey. Dr. Nadir returned to Pakistan to join the Faculty of Neurology at the Khan University Hospital and has been engaged with problem-based learning since, and has chaired the Neurosciences Module Committee that developed the Neurosciences curriculum. He has over 25 international research publications and citations in many leading journals, and is a member of the American Board of Psychiatry and Neurology, the American Board of Electrodiagnostic Medicine, and the American Board of Psychiatry and Neurology Clinical Neurophysiology. He also serves on the board of TAF Foundation. Over to you, Dr. Nadir, for your introduction and sharing with us your views. Thank you.
Thank you so much. It's a real pleasure for me to be here. So I'm basically a neurologist. I see patients, and neurology involves seeing a lot of older patients. So that's what I have been doing all my life. That's what I was doing this morning. And after this, that's what I'm going to go back to my clinic to do. So I only have 5 minutes, so I'll be quick. 15 million older people over 60 in Pakistan. By 2050, they're going to be over 40 million. So clearly, a lot of older people, and these people are living older. So that sounds really great. But let's take one step back. What's the quality of the life that they're leading? It sounds great to have extra years of life, but if those extra years are spent in illness, health issues, deprivation, whether it is food deprivation or social deprivation or exclusion from society, then those extra years are not so attractive. And that is, to my mind, what healthy aging is all about. It's not just about absence of disease, but it's about integration with society, acceptance by the society in a productive, meaningful way. So let me move on to what the barriers in Pakistan might be to this utopian construct. Let me talk about two things that I picked up. One is lack of infrastructure. What does infrastructure mean? Infrastructure means housing and care centers and trained personnel who can take care of elderly, doctors, laboratories. As the aging population grows, we'll need more and more of that. And of course, this is critical. But this is going to be a task. When you're talking about millions of people and developing housing and food and medical services, it's a major task. That is the biggest challenge. But there is a second part of this, which is, I think, more amenable to fixing, and that is the burden of preventable diseases that we see in Pakistan. Now, let me give you just 3 quick examples. 1/3 of males in this country smoke, 1/6 of females smoke. So just a factoid. Hypertension. Above the age of 45, 1/3 of everyone is hypertensive, has high blood pressure. So if there are, I don't know, 24 people, 6 of us are hypertensive. Or 8 of us are hypertensive. Then 1 in 7 people in this country is diabetic. So this is a huge burden of disease. And what these 3 conditions, smoking, blood pressure, and diabetes, do is they account for the biggest burden of disability and death in the older population. And what am I talking about? I'm talking about 4 conditions: dementia, heart disease, stroke, and ischemic heart disease. Oh, sorry. Cancer. You see, that's not my field. I don't see cancer, but I see stroke, heart attacks, and dementia all the time. Cancer. And these 3 have a major contribution to disability in the older people. So what I see these 3 points is as the low-lying fruit that can be readily addressed. Smoking, because most diabetics and hypertensives in this country are not diagnosed, and if they're diagnosed, they're not treated. They don't know how important it is, how it can lead to dementia, how smoking can lead to cancer. I think a lot of effort is put in, but it is not effective. And I had 3 thoughts on strategizing. One was engagement of NGOs and non-state players. The reason for that is 70% of medical care in this country is delivered by the private sector. So the government is already compromised with respect to taking care of people. Then use of technology. 40% of this population, so that is 100 million people, are on the internet in Pakistan. This country of 220 million people has 160 cell phone connections. So these are things that we need to utilize. And lastly, I would say, whatever strategies we come up with, we have so many ideas, but it should be driven by research, by talking to the vulnerable community, and it should be driven by what they want, what is likely to be successful, and what is relevant to our particular society. So I think I'll stop right here. Thank you for your time. And I hope to have a good discussion.
Yeah, thank you very much. Thank you, Dr. Nader. Yes, you are absolutely right. And I think here we must congratulate and felicitate TAF Foundation, which has taken this initiative, and they are, in collaboration with certain other organizations as well to promote this elderly healthcare services. Now we come to Dr. Hina Hussain Kazmi, our next speaker, who is the Chief Operation Officer of the TAF Foundation, to give a brief overview of TAF's Will Age initiative and its vision. Dr. Hina Kazmi has done her doctorate in linguistics from Hamdard University and has a distinct position in the national scenario of the development sector. She has worked with multiple donors like USAID, DFID, World Bank, and possesses thorough understanding of project management and result-based strategies. Her special interest and experience have been in poverty elevation, gender equity and access, and adult literacy. Ladies and gentlemen, Dr. Hina Kazmi.
Thank you very much, and Assalamu alaikum, everyone. Thank you very much for coming here. Thank you, online colleagues and friends. Talking on initial ideas on this decade of healthy aging 2030. I was going through literature, and I saw that there are 4 actions that United Nations General Assembly Declaration suggests. And I'll name them, and then I'll come up to the specific area that I am going to talk about. The actions that were declared were voice and engagement by elderly and by those who are aging, not only the aged, but also those who are in the process of aging. Leadership and capacity building, for example, like as Joanne was saying, the technology side for those who have reached a certain age and without it. So taking help from their leadership and providing them the technology. Then the declaration talks about connecting stakeholders, bringing government, civil society, NGOs, common people, business, lawyers all together, and talking about this process of a healthy aging. And then they said that strengthening research and innovation is one thing that is required for moving towards healthy aging decade, because it's very, very difficult to have data and research around this area, and it is the area that is least touched upon. So it's as Dr. Nader was saying, that most of the people are living beyond the age that was there, let's say 30 years back. So longevity has come to human life, but it's not only the health services, but it's also the social side of health. And it's called social determination in health, which means that it's important to know how people live, how people grow, how people interact, how they make relationships. And here comes the variety and the flexibility in this decade in the developed countries, in underdeveloped countries, and developing countries like ours. What United Nations has aimed at is to talk about the income and the social status of those who are aging, education, working life style, early childhood development, they say, is very important in healthy aging. So you start this and you take this decade, not only for those who are above 60 or above 50 or above 55 or whatsoever. It starts from early childhood development. Like the early childhood has impact on a healthy aging, time of a human life. Moving ahead, it's unfortunate to say that there's inequity in old age. Not all people in this world age in a dignified manner, in a healthy manner. It's because of the resources that are not equally distributed. So for that, the social determinants of health is a complex area, because it's difficult to collect data. It's difficult to talk to people because each individual is a data itself. So when we are talking of the number that were provided here for the elderly people, billions of people in the world, it means billion researchers. That becomes a challenge. Talking about this, the evidence-based social development of a human being, so that he or she can age with health. There are 3 areas of critical action that is talked about in this declaration. And those 3 areas are improving daily living, which means that right from the very beginning, we have to look on how people are growing, how people are living, what people are eating, how people are interacting. And unless we concentrate on that area,